Increasing capacity and adapting healthcare for the needs of COVID-19 patients is described by the WHO as a fundamental outbreak response measure. The ECDC and the European Regional Office of the WHO have issued guidelines for hospitals and primary healthcare services for shifting of resources at multiple levels, including focusing laboratory services towards COVID-19 testing, canceling elective procedures whenever possible, separating and isolating COVID-19 positive patients, and increasing intensive care capabilities by training personnel and increasing the number of available ventilators and beds. In addition, in an attempt to maintain physical distancing, and to protect both patients and clinicians, in some areas non-emergency healthcare services are being provided virtually. Due to capacity limitations in the standard supply chains, some manufacturers are 3D printing healthcare materials such as nasal swabs and ventilator parts. In one example, when an Italian hospital urgently required a ventilator valve, and the supplier was unable to deliver in the timescale required, a local startup received legal threats due to alleged patent infringement after reverse engineering and printing the required 100 valves overnight. On April 23, 2020, NASA reported building, in 37 days, a ventilator which is undergoing further testing. NASA is seeking fast-track approval. Individuals and groups of makers around the world also assisted in the efforts by creating and sharing open-source designs, and manufacturing devices using locally sourced materials, sewing, and 3D printing. Millions of face shields, protective gowns, and masks were made. Other medical supplies were made such as shoes covers, surgical caps, powered air-purifying respirators, and hand sanitizer. Novel devices were created such as air savers, non-invasive ventilation helmets, and ventilator splitters.